Hey guys, how are you all? Welcome back to MedSteps YouTube channel. So today in this video we are discussing about sensory and motor innervation of the nerves in the upper and lower extremities. So before we are going to topic, we have to understand what is the brachial plexus, because for upper limb that nerves is coming from, that means it's originating from brachial plexus. So what is brachial plexus? Brachial plexus means that nerves coming from cervical region, that means C5, C6, C7, C8 and T1. These nerves coming from our cervical region, this every nerves we call that is the brachial plexus. So what is the brachial plexus? In this brachial plexus we have some different types like roots, trunks, divisions, cords and branches. First one we are discussing about roots. We have in brachial plexus we have 5 roots like spinal nerves C5, C6, C7, C8, T1. This roots is located between anterior and middle scalene muscles. So next, then after roots we are seeing trunks. The trunks we have 3 trunks, it will divide and it form as roots emerge from the neck. So how many, like what are the trunks we can see, like upper trunk, middle trunk and lower trunk. Then after we can see each trunk it splits into 2 divisions, like anterior division it supplies flexor muscles and next posterior divisions it supplies extensor muscles. So then after this division it's going to divide into cords. That cords like lateral cord, medial cord and posterior cord, it formed by rearrangement of divisions. Then after final thing, the final thing, the cords is going to divide into branches. This is the main branches we call, that is the nerves. What are the branches we can see, like musculocutaneous nerve, axillary nerve, radial nerve, median nerve and ulnar nerve. So when it's coming to, first we are discussing about axillary nerve. Axillary nerve is originate from C5 and C6, and here we can see from where this nerves are coming, means it's from lateral side, from lateral to cervical vertebra, and it will comes to lateral sides, and that now we call axillary, the axillary nerve will coming from posterior onwards, that axillary nerve will pass, and the main function of the axillary nerve is abduct the shoulder, like that axillary nerve innervates deltoid muscle. So what are the like functions we can see? In motor we can see deltoid muscle function and teres minor and triceps, and in triceps long head. When it's coming to sensory nerve, we can see lateral upper arm, or we can tell like surgeon's patch. Okay, next we are discussing about musculocutaneous nerve. This musculocutaneous nerve is coming from like lateral to cervical vertebra. So then after main function of this musculocutaneous nerve is flexing of the elbow, that means elbow flexion. What are the muscles it's innervating, means biceps and brachialis. So here the nerve root is C5 and C6, and the motor function is biceps and brachialis muscle innervation, and in sensory we can see lateral forearm, we can sense the nerve. Okay, next we are talking about radial nerve. The radial nerve is originating from C5, C6, C7, C8, and it's originating like from posterior cord, and its the main function is elbow extension and wrist extension and fingers also. So here the motor function is triceps, like medial and lateral heads, wrist, thumb, fingers extension. Next in sensory we can see lateral dorsum of the hand and medial upper forearm sensation we can see this innervation. Next, median nerve. The median nerve is originating from cord like lateral and medial cord, and the main function of the median nerve is flex, wrist flexion and fingers flexion and thumb muscles also. So here in median nerve, in motor function we can see wrist flexors and abductors, flexion of the first 3 digits, and palmar. In sensory innervation we can see palmar thumb to radial of a 4 digit and the dorsal tips of the digits 1 to radial of digit 4. Okay. So when it's coming to ulnar nerve, the ulnar nerve is originating from C8 to T1 and is a medial cord. And what's the main function of this ulnar nerve is hand. It will innervates the hand muscles, so hand movements like abduction, fingers abduction and some forearm flexors also this ulnar nerve will do. Okay. So in ulnar nerve, that in motor innervation you can see wrist flexors and adductors, flexion of 4th and 5th digits. In sensory innervation we can see medial palm and dorsum of hand 5th digit and medial half of 4th digit, right. So when it's coming to lower extremities, in lower extremities we can see the sacral nerves or sacral plexus. So here we can tell like tibial nerve. This tibial nerve is originating from that nerve root is L5 and S1, and it's the main function, motor function is we can see the like ankle plantar flexion and knee flexion and great toe flexion, and in sensory sole of foot. Here this is the what's the main important clinical importance means mostly if any person have sciatica or lumbar disc herniation, that time based on this flexion and knee flexion and great toe flexion, that person will get pain. That pain also spreading pain from lower back to it will radiate to the great toe of the tip of the great toe. So that time we can understand why they are getting the pain and where they are getting that compression and are pinching now. Okay. So here this is the tibial nerve. Then after we are discussing about superficial peroneal nerve. The superficial peroneal nerve is nerve root is L5 and S1. The motor function we can see ankle eversion, and in sensory innervation we can see dorsum of foot. Next we are discussing about deep peroneal nerve. The deep peroneal nerve is originating our nerve root is L5 and S1. The motor function is we can see the ankle dorsiflexion and inversion and great toe extension. When it's coming to sensory, first web space we can see in sensory innervation. Next sural nerve. That sural nerve is the nerve root is the nerve root is coming from S1 and S2, and the sensory innervation is lateral foot. Next saphenous nerve. The saphenous nerve is the nerve root innervating from L3 and L4, and the sensory innervation is anterior medial ankle. Okay. So here we understood from where that nerve root is originating and what is the function, and sensory and motor innervation, everything we understood. But here if anything, any damage or any compression happen in upper trunk, we can see Ebb's palsy. Ebb's palsy is also called waiter's tip, because in upper trunk we can see deltoid and biceps paralyzed, means that child or that person will get Ebb's palsy. Next in lower trunk, if any person have any compression or any injury, means it can lead to clump case palsy, that means claw hand. Claw hand means it's like intrinsic hand muscles weakness. If any person have long thoracic nerve injury, then that person we can see like sign of winged scapula, the scapula will elevate. If any person have like axillary nerve injury, then we can see deltoid muscle wasting or shoulder abduction loss, and this type of things we can see. Mostly what are the main injuries can cause axillary nerve injury, means like surgical neck fracture of humerus. This thing, if humerus surgical neck is got fractured, then axillary nerve will get tear or some injury will happen. That time we can see this axillary nerve injury. Okay, next radial nerve. In radial nerve, the total wrist will drop. So what are the injury? Like compression of axilla, like if any person using crunches or Saturday night pulsing, that means if any person drinking alcohol and he is lying on his like biceps, that time that compression, that radial nerve compression will happen. So that person can leads to radial nerve palsy. Next, median nerve. If any person median nerve injury happen, means we can see like ape thumb or carpal tunnel syndrome, that type of things we can see. In ulnar nerve we can see like claw hand. So this is the sensory and motor innervation and some clinical importance also we discussed in this video, and like sensory and motor innervation of the nerves in the upper and lower extremities. If you like this video, subscribe my channel and we will discuss more topics in our next video. Okay, thank you, take care, bye bye.